Let's get oral.
Howdy, howdy. Welcome back to Let's Get Oral. I am Jonathan, one of your lovely and friendly co-hosts here with the crew. And today we have the great pleasure to sit down and chat with Shavonne Healy. She is a dental hygienist turned entrepreneur in the DC area who's been doing wonderful work providing education, curriculum, and continued development for both hygienists and patients who are very interested in just making the community a healthy place. So Shavonne, welcome to the show.
Hi, Jonathan, and hi, everyone who may be tuning in. Thanks so much for listening, and thanks for the invite.
Of course. So for the listeners, I just sharing briefly, like many people these days, Shavonne and I originally met on the interwebs. So, shout out to LinkedIn.
Yes.
I was very fascinated by not only her story, but her contributions to the community. And, I didn't even know that there's a ranking system out there for hygienists, but I feel pleasure to be speaking to one of the top 10 hygienists in the U.S. So
that would be me. Yes, that would be me. I got to own it.
Yes. So now you're going to have to prove it here, right?
Yes.
So first, we usually like to start kind of at the beginning, Shavonne. So could you first just tell us a little bit about your journey into dental hygiene and what inspired you to become a hygienist?
Sure, I would love to. So I grew up, I had a modest upbringing. My mom was a single parent of 5 children. And when it was time for us to go to high school, she didn't give us a choice. She sent us to a technical school, a vocational high school, where you, as a student, had the ability to explore all of the different trades, electrical, culinary, nursing, accounting, dental assisting. So I have to just, give praise to my mom for making that decision for her children. She felt like college wasn't for everybody, and she wanted her children to have a trade to fall back on just in case we didn't choose that, continuing education path. So when I first entered into high school, I had the idea that I was going to be a chef. So I was very interested in culinary. But being 14 years old, and for anybody that doesn't know how vocational schools or programs work, half the year you're in academics and half the year you're learning your shop or you're learning your trade. So one week you're in academics, like regular high schools, and then the next week you'll be in your shop. Originally I wanted to be a chef. I had an interest in culinary arts, but when it came time to choosing your trade, none of my friends wanted to pick the same shop as me. So being 14 years old and wanting to be with your friends, I went with everybody else. And most of my friends were choosing dental assisting. So I didn't choose it. It chose me, I like to say. And I'm a true believer of, one of MLK's famous speeches when he talks about, if you're going to be a street sweeper, be the best street sweeper. And so, if you're going to be a janitor, be the best janitor. If you're going to be a microbiologist, be the best microbiologist. If you're going to be a dental hygienist, be the best. So it didn't matter what area I chose, it doesn't matter what path, my goal was to strive to be the best. So I ended up graduating, top of my dental assisting class. At the age of 14, I landed my first job as a dental assistant. I was making like $6 an hour or something like that. And then when I was a junior, my dental assisting teachers really inspired me to consider to think outside my little box, my little modest box that I was living in, because you can't see beyond your own beliefs about yourself. So my instructors were just, you're very good at this. You should consider becoming a dentist. And when I learned that it would take about 8 years of college to do so, I wasn't interested. I was 18 years old. What can I do in a shorter amount of time? And that's how I learned about dental hygiene.
That's fantastic. Yeah, well, first, kudos to your mother,
Hmm.
right? And having the foresight of being able to provide you and your siblings, right, a different experience that probably at the time was going against the grain in many ways, since college was just considered like this is the next step you have to do, higher
Hmm.
education to be
Hmm.
successful in
Hmm.
society. And then just now looking at today's climate, right? And
Hmm.
the fact that, I mean, we will not talk about. I always bring food up somehow in our podcast because I apparently love food so much
Uh-huh.
and try to bring it back to health. So I do want to hear more about the chef stuff, but we can do that offline.
Hmm.
So
Hmm.
I'm glad hygiene chose you.
Yes, yes. And that's how I ended up going to college, because obviously you need a degree in dental
Hmm.
hygiene, but my pathway was through dental assisting, which many dental hygienists were dental assistants,
Hmm.
before they were dental hygienists. Um, and the other thing too is that I not only was I able to bring myself out of poverty, because we did grow up on welfare, but I was able to bring my entire family. I have a sister that's a dental hygienist. I have a sister that's a registered nurse. And as adults, we took very good care of my mom. Unfortunately, she passed away last year from pancreatic cancer. But really, the praise is all to my mom, and for those very important decisions she made for us.
Yes. Yeah. Rest in power. For sure.
Amen.
Mhm. I'd be curious to hear from your training onwards to now as a practitioner, or at least while you were there any particular case studies or patients that
Hmm.
really just molded you or influenced you in a way that makes you that much better of a practitioner today?
Oh, absolutely. There's so many, but the one that sticks out the most. When I graduated from hygiene school, I did what usually the instructors advise you not to do, which is to kind of like not start in a specialty practice. So I actually worked full time for a periodontist, and I worked part time for a pediatric dentist. So I was working 6 days a week. I was young, I had the energy. And this particular pediatric office that I was working at, the doctors, some of the founders of the practice, had children that had special needs.
Mm,
So one of the doctors had two adopted children with Down syndrome, and another doctor had a child with autism. So we saw a lot of children with those kinds of special needs. Coming right out of hygiene school, we learned about these different special needs, but we didn't really encounter them a lot, while you're in hygiene school. So
correct.
I remember, I it was my first couple of months at this job, and I had a patient. His name was Marky. He was 18 years old, and he was autistic nonverbal. And looking back at his record, I could see that it was always just a quick visit. Wouldn't allow for full debridement, unable to take X-rays. Just his whole history, and he had been going to that practice since he was about four years old. This is
Oh
my
wow.
first time. This is my first time meeting him. I bring him back. I'm talking with the mom. I would ask him questions, and the mom would answer the questions, and then he would grunt and make a noise. So that's how we were communicating. So I found out that he was a sophomore in college, majored in jazz. I mean, if you're a jazz major, you
Wow.
to me you're a genius. I'm a big jazz fan. So I was able to complete the entire appointment, providing a full standard of care. I was able to take a panoramic film and obtain four bite wings on him. So that was a huge step for this patient that had never had these things before. So when I saw him 3 months for his recare visit, the mom pulled me aside. They actually requested to see me again. And the mom pulled me aside and she said, thank you so much for making a difference in my son's life. And I'm like, what do you mean? What did I do? And she was like, you treated him like a person. You treated him like a person.
Mm,
And then it was in that very moment, I promise you, that I realized that this role that I'm in was bigger than what I could have ever expected. Like
right.
I am positioned in a very unique um, position where I can truly impact the lives, the quality of somebody's lives. And,
Mm,
fast forward, I graduated from dental hygiene school in 2003. Fast forward to now, and I still get these kinds of interactions. I still have these kinds of where a parent comes up to me and says, "Thank you for treating my son like a person." Thank you for treating my child like a person. And I tell these patients, if you feel like you cannot find a provider that can meet your need or your child's needs, then you have to go to the Board of Dentistry and you have to advocate for mandated continuing education courses to be completed in order to renew your license, because otherwise providers aren't going to take these kinds of continuing education. So for patients that feel like they can't find a provider that cannot meet a specific need, especially if it's a child with a disability, it's
mm.
probably because they don't have the knowledge and they don't have the skill. And so
Yeah.
that's how patients can empower themselves to get more competent providers.
Yeah. Wow. Kudos to Marky and their mother. What you said definitely resonated with me in a few ways. And I want to acknowledge the tension, though, too, because I think most people who go into any healthcare profession, let alone um, dentistry, whether as an assistant hygienist, a perio person, etc., I think we are inspired to do it to help people. But to your point, whether it's the institution or time or whatnot, these special needs cases tend to get put to the side and
Mm-hmm.
take away the humanity, right? Versus the role they play for a billing or a time slot or whatnot. So yeah, thank you for doing what you do and seeing the people as a person. But I'd love to hear more if you have any thoughts on it's one thing for a parent or a patient to advocate for themselves. What is it that we can do more on the clinical side, whether it's directly at a practice or through advocacy work to help bridge those gaps in care, especially for those people in need or special needs?
Yeah, we have to bring awareness. We have to bring the awareness, and we have to remind healthcare professionals of our purpose. We are healthcare professionals are supposed to advocate for the betterment of society.
Hmm.
You're right that some people go into healthcare because they want to help people, but I think that we also have people that go into healthcare because they want to make good money. So just spreading awareness. If you're somebody who has an expertise in this topic, I encourage you to consider building continuing education courses and helping to educate healthcare providers of the different special needs. But that's our starting point, is just spreading awareness and helping others think outside the box of your typical, mainstream dental hygiene or your typical patient. We just have to spread awareness and educate, and just remind healthcare providers that it's their responsibility to be competent so that you can meet the needs of the unique population. And if you're not able to meet the needs of a particular patient, you have an ethical responsibility to refer them to somebody who does. But then those providers are also burdened with patient overload because it's such a the need is lacking. There aren't many places where children that are or people that are disabled or have special disabilities. There's not many places for them to go. So I think we just have to retrain the brain of healthcare providers to remind them of our true purpose, and everything starts with education. So we've got to get these kinds of programs into the educational systems that are available to us.
Absolutely. When Camille and I were at Lincoln Memorial University earlier this year for the IDM symposium. I really appreciated the efforts that the directors and the teams there put on having the students essentially from day one work with as many people from their respective communities. And this is being in Tennessee. And while it's not a rural town, there are definitely parts in the hills and whatnot for people who probably have not typically had as much regular access to dental care. And so I appreciate that they would go out of their way to provide such services to them, because you have a spectrum of people with, I mean, it's just a crazy phrase, but like people with what they call like Mountain Dew mouth or
Mhm.
these other conditions and socioeconomic demographics that impact their lives systemically. And so
Mhm.
I think to your point, when it comes to education and advocacy and having the students being involved so early on in their care, I think helps sets them up to be able to carry that through
Mhm.
into their profession as they branch off and go, whether they stay locally or just decide to open a practice or work in someone else's practice down the line. So,
Yeah, it doesn't matter, I don't discriminate. I treat everybody
mhm,
like a person. It
right.
doesn't matter to me how you present to me in my chair. Everybody's going to get the same kind of compassionate care. It's sad. It's sad to hear, when I do meet patients or parents that share this with me. It's heartbreaking.
I
But
bet.
we have to look at how we're being educated, and I think that the whole, dental hygiene education, the dentist education, it needs some serious revamping.
Mm, mm. That is a good point for my next question. And I think we could spend some time chewing on. Um, I'd love to hear from your perspective some misconceptions that you either aware of, may hear about as a hygienist when we talk about oral care, right? Like I'm a mouth nerd and a microbiologist, have my own ideas and thoughts from the outside in some ways, but as someone who's been integral for providing and working not just with other like perio or hygienists or assistants, but also patients. So I'd love to hear what are either common misconceptions, and also if you could choose any examples that might have surprised you as a misconception.
I think one of the biggest misconceptions that hurts the profession the most, or just really the public, is the lack of understanding of the role of the dental hygienist.
Say
um,
that again. Say
yes,
that again.
we when you if we're truly an evidence-based practice,
Mm,
dentistry would look a lot different. You would have the dental hygienist as the primary care provider. All of the literature, all of the research, all of the experts, you know, the endpoint goal is that we need to be able to prevent disease. We need to be able to intervene at the earliest stages of life. Huge focus on prevention and oral hygiene education. Okay, the dental hygienist is the only healthcare professional that graduates with these kinds of competencies. We are centered on oral health education and prevention. Most patients think that we're the dentist assistants. Most patients think that we, clean teeth. And on a political perspective, when we're talking about the issues and access to care, the dental hygienist almost never comes up. Increasing reimbursement rates for Medicare and Medicaid are not the only way to resolve the access to care issue. So that's the biggest thing that's hurting society as a whole, is the dental hygienist is underutilized, and I would be so bold to even say oppressed, because we work under the supervision of a dentist. The dentists control our schedules, they control what kind of supplies that we have. So that's the big thing. The other thing is that from a patient perspective, patients think that, well, first of all, they think plaque is food, so that's that's a big misconception. Food does play a role in in the processes of plaque, but patients don't understand that it's bacteria. And the other misconception is that in order to prevent cavities, we have to floss our teeth, and that is not true. Patients need to understand the role of diet and frequency of food consumption. But the biggest misconception is that it's just a cleaning, as it relates to oral health and the importance of visiting your preventative provider. I'm trying to think of any misconceptions that I think it's still surprising. It's still surprising that this kind of information with how technologically advanced we are as a nation, right? From healthcare technology, it's still surprising that some of these myths still exist. Some of these that it hasn't reached more of society. The role of the dental hygienist, and how to prevent diseases, from a patient perspective as it relates to diet and whole body health.
Yeah. Oof. That's real. That's real.
I think this is a good point to bring in the question that I asked you earlier before we got started. With your background as a microbiologist, how can you help break the misconception of what dental hygienists do is clean teeth, or the patient's thought of it being just a cleaning?
Right. And for our audience, my original and initial answer is, I think, in line with what you said when it comes to education,
Hmm.
right? And how do we bring that to one's eyes? And I literally mean like to one's eyes, because when we, I think society, when the way we think and treat a cleaning, right, it's secondhand to many other aspects of our quote unquote hygiene and care. I feel like when you're talking about, is it a 6 month thing? Just throw it on the calendar. Is it really important? My teeth look white, or I don't
Hmm.
have a toothache.
Hmm.
It's easily dismissed before one even gets to the chair, and if they do make it to your cleaning, right? If a patient just feels that it is routine and all is well or whatnot, I think the opportunity that's lost when it comes to education in that particular space is being able to actually see what's going on. And when we're talking about cleanings to remove plaque and debris and scaling and everything that goes on throughout a cleaning process, I think if the patient, with the care and help of the hygienist and or the assistant and the other team members to help literally visualize what's going on. So does that mean having a camera and a monitor to the side to where the patient can actually see, or using fluorescence or a microscope or something that can help build the bridge between, oh, this is just a cleaning, to now, oh no, this is the stuff that is growing and active of your oral ecosystem that contributes to plaque. And these are the things that feed off the sugars and the things from our diet that can contribute to the erosion of your enamel, or to inflammation that's going on under your gums or in those crevices. I think being able to help build those bridges through education, but also being able to help visualize them, might make it stick, no pun intended, with plaque, a bit more for the patient, while also giving the hygienist and healthcare team an opportunity to build upon those teachings. And I think if you could start that at the, since this is something that's important for every stage of life, if we can start with children, right, in the ped space, and have the parents present, I think it helps reinforce the parents to want to help prioritize oral care routines and hygiene at home and do it as a shared experience with their children. While I'm not expecting them to become a microbiologist overnight, but I mean, kids remember things, right? And
Mhm.
so maybe they'll think it's cool to see the fluorescence or the microscope or whatnot. But if it's something that sticks with them to want to continue bringing that care more backed off of that educational experience, I think that goes a long way with transforming it from becoming or being just a cleaning to now, oh, if this is what's actually going on in my mouth, in my body. And yet, through these preventative care practices, this can help maintain, hopefully, an improved quality of life over time. If I stick with my quote unquote oral care chores at home while also making my regular visits with the care providers.
Yeah, you know, what we do or don't do, what we have access to or don't have access to as children, teenagers, and early, or even early adulthood, is determines, your life when you're 40, 50, 60 years old.
Correct.
So, earlier I said that if we were truly an evidence-based profession, that the hierarchy would look different. You'd have hygienists on the top, as primary care providers. Um, you know, as a profession, it's also very important to understand our history, because it's not the patients
Mm,
that just think it's a cleaning. It's also many dental hygienists use that language, and dentists use that language as well. So, um, you know, education is the core of everything, right?
right.
Not just as how we educate our patients as healthcare professionals, but the kind of education that we have access to as professionals as well. But one thing that's important to understand is history. The first class of dental hygienists in the early 1900s, when they graduated, they worked in the public school system. Fast forward to today, more than 90% of dentists and dental hygienists, when they graduate from dental school, they go into private practice.
Hmm.
So we've lost our purpose. We absolutely should be back in schools, educating children on oral health and nutritional counseling. And some, I'm a progressive person, but there are some instances where I think that we need to go back to the basics. And in dental hygiene school, we do learn how to, it is part of our process of care to be able to disclose the patients so that they could see their oral biofilm. But unfortunately, like I said to you earlier, we don't have control over that. So we don't, in many instances, we don't have time for it in our 30-minute, 40-minute appointments, sometimes less, given your situation. And we also don't have access to those kinds of equipment and materials. So that's the dog chasing the tail.
Right. Right. So true. No, I appreciate your call out to getting back to the fundamentals. Right.
Yes, yes, yes.
And the power of history too. Right. Like
Hmm.
it's, we always say knowledge is power, but knowledge is based upon history in
Hmm.
so many ways.
Hmm.
And unfortunately, how much of that, depending on the group, has been lost or forgotten due to other forces. So I appreciate your acknowledgement and call out to that, because I think that's something that more of us need to not just hear, but really like sit with,
Yeah,
including myself. I'm not going to act
yeah.
like I'm excluded from this.
Well, knowledge is power, but it's nothing if you can't implement the knowledge. Just like data and research is power, but it's nothing if we can't implement it. So until we're able to do these things, unfortunately, caries is going to remain it's still the number one chronic childhood disease.
Right.
Patients are going to, the public is going to continue to suffer if we're not able to be the evidence based profession that we claim to be.
I think this is a good place to transition to hear more about, I don't want to call it a pivot, but your continuing evolution as a professional from not only providing care as a hygienist, but also leveraging that knowledge and data and research to found a higher learning. So, could you tell both myself and our audience what inspired you to create a higher learning? What is it? Who does it serve? And what does the future look like?
Yes, yes, I will try to do that. I forgot to mention to you earlier that I'm terrible at these things. I'm terrible at interviewing. I'm terrible at talking about myself. Um, but a higher learning is an organization that I established right before the pandemic started. I
Great
actually
timing.
I actually established it in January of 2020. And then we all know what happened a few months later. But it was
Mm,
actually a blessing in disguise because I had more time to really think about, what direction do I want to go in with this? Because, a higher learning basically is me. And we are dedicated to advancing the field of dental hygiene. Um, and we have a commitment to do this through advocating for excellence, innovation, and ethical leadership. So, a higher learning is an educational institution, but it's more than just that. Like, we are a catalyst for change. We want to shape the future of oral health care through cutting edge, education, pioneering practices, a tireless pursuit of excellence, but most importantly, using data driven approaches
right.
with best practices, advocating for policy change, and patient and clinician autonomy and well being. Those are the foundational pillars of the work that we do. Um, you know, um, uh, as the CEO of A Higher Learning, I have a strong foundation in ethics and law. I believe that these are the driving forces for best practices. So the endpoint goal really is to help gain professional autonomy through the work for our profession through the work of A Higher Learning. We do that in many different ways. We host, world-class symposiums. We also host virtual continuing education opportunities. We mentor students for the future and inspire, and that's how we inspire the future. But most importantly is the boots to the ground grassroots root work that we do as it relates to policy. So most recently, in DC, we actually passed into law dental hygienists to be able to work in collaborative practice agreements. So our goal is independent practice here in DC, and then hopefully we can take that motivation and inspire that to be, for the rest of the nation.
Okay. Yeah, because I was going to ask, with that recently passing in DC, do you think that'll provide a model or a template for other states to implement if you have advocacy groups interested in doing so?
Well, we use the templates and models from other states. So
Oh,
we
okay.
we we are definitely not the first state. As a matter of fact, states like California, Colorado, Maine, dental hygienists have more professional autonomy. In some instances, they have full independent practice. So we were able to, stand on the shoulders of leaders who've paved this way, and that's some of the research that we brought into our arguments is that, other states are doing this. DC has one of the most restrictive scopes of practice in the country. We are not a direct access state. Even with the collaborative practice agreement, we still are not a direct access state. So there's still more work to do as it relates to the regulations that support this new collaborative practice agreement law. There are, I think, 42 states are allow direct access, meaning that the patients can see a dental hygienist without having to see a dentist first. And there's literature to support that when in states where patients have, more direct access to the dental hygienist, we have, overall better health, less teeth extractions, for example.
Wow, that is fantastic.
Yeah, so I like to say that I'm a small business owner. I founding the business in January 2020. I'm 4 years, getting ready to go 5 years in. I've learned a lot. There were things that I wish that I did differently, before
Mhm.
I started, but when you know better, you do better, and you can't wait for everything to be perfect before you make that leap, into greatness, essentially. So started a higher learning, very blessed to have that in between time to think more about it. And, I'm definitely, the path forward is clear and the
That's
work that
awesome.
I do through a higher learning. Yes.
Are there any organizations or institutions you collaborate with regularly through A Higher Learning now?
There are several dental hygienists that I collaborate with, especially as it relates to having dental hygienists on my platform as speakers and things of that nature. I do lots of work with my alma mater, Phone School of Dental Hygiene. This year, we hosted the first international symposium on preventive and non-surgical dental hygiene at the school, at the location. And what's unique about that is that Phone School of Dental Hygiene is actually the first dental hygiene school in the world.
Oh, wow.
Bridgeport, Connecticut is where the profession was born. Irene Newman in Bridgeport, Connecticut was the world's first dental hygienist. So that's like the full circle there. And from a grassroots perspective, there's lots of community stakeholders that I collaborate with and do this work with. For example, I work with public health attorneys from Georgetown Law Center, which I think is an untapped resource for dental hygienists trying to do this kind of advocacy work. Is reach out to your local law schools, learn about their free clinics that they have that are available to you. So I work with their public health clinic. And the reason why that's important is because the supervising attorney at the center and their students, they do all the work. I
Yeah.
tell them of the barriers. I tell them of, the laws that don't make sense or create barriers to access to care. They do the research. They write the testimony. Right now I serve on an oral health coalition where we do work with the local dental society, local federally qualified healthcare centers. It's social responsibility, right? Because we have a huge access to care problem. We know that healthcare is really only available to those more um, you know, uh, wealthier members of society.
Yeah.
And so in order to really impact change, you can't do that without policy. And really it's going to take all stakeholders, and that have a stake in oral health need to be a part of this work. So definitely takes a team approach to push things forward.
Of course. I am excited to see how you and A Higher Learning continue to grow and build upon the work, the courses and presentations you're already providing. I did see that one of your upcoming courses is on exploring cannabis and oral health. Me being
Yes.
in California, we know a little bit about
Right,
a
right,
little bit
right,
about that, but
right.
I appreciate that. You're providing that forum and a platform for, I believe it's Kimberly Farley
Yes,
giving that presentation. Like, I
yes,
appreciate that you're even bringing that discussion forward,
yes.
um, because it's here.
Yeah, we
Whether people-
and in the District of Columbia, we have a nickname, the District of Cannabis.
yes, yep,
And our role as healthcare professionals, just like you have patients that you have to be able to meet the needs of a patient with special needs. We also have to make sure that we're able to meet the needs of patients that maybe use cannabis for whatever reasons. I am a pro cannabis advocate, especially for the health benefits as it relates to cancer patients. And Kim Farley really gives a wonderful. I mean, she's one of the best. The whole topic is personal to her. I'm not going to share her story. She talks about it in her presentations, but she really does an awesome job of walking you through it's supported by evidence, walking you through how, medical marijuana should be looked at more as an exit drug for certain conditions like, alcoholism, for
Mhm.
example. We're talking about changing mindsets.
Right.
There's a lot of health benefits for it, especially to manage pain. And we need
Mhm.
to be open to learning about that, and most importantly, how to help our patients. If you are using cannabis, how are you able to use it in a healthier way? The American Dental Association also put out kind of like a notification that providers need to start taking this kind of education as well. And, I actually have friends and family that were, um, you know, had suffered from addiction like alcohol abuse, and through medical marijuana they were able to overcome these addictions. So I've seen it real time in my life, just this different approach to helping people get help, because the reality is that we live in a very stressful world. We live in a very stressful society, and whether you like it or not, need people want to, need to, and will do something to take the edge off.
Yes.
Now, some people prefer to go to a bar and take a couple of shots of, alcohol. Some people prefer to do, I don't know, maybe cocaine. We just have to help our patients choose wisely and choose the least damaging
Right.
choice. So that's how I look at it. I don't judge patients that are open about using it. I'm just here to help and make sure that they have the information. And the same thing for providers, making sure that they have the information. So definitely encourage you to get Kim on the show to talk about her work that she does in this space, because it's pretty incredible. But my goal with A Higher Learning too is to fill those knowledge gaps. And I like to pat myself on the back because I feel like I have some pretty unique courses that I've offered so far. Something that I do every year is the Public Health Priorities Dental Symposium. And the goal of this symposium is to focus on bringing awareness to all those public health topics that are not at the forefront and most certainly need to be.
I'd like to hear. I don't like doing favorites. I feel like why limit to one thing when we could share about a few. So, could you share a couple of your previous courses, meetings slash symposiums that you've helped conduct at A Higher Learning that was very informative for you? And then I'd love for you to follow up to share if you have beyond the cannabis and oral health one, any additional meetings slash events that you're planning to host. Because we do have a good amount of hygienists I've heard that listen to this podcast, so
Oh, okay.
they might be interested in hearing.
I think one of my most powerful works so far has definitely been the public health priorities dental symposiums.
Mhm.
This year we had a lecturer, Dr. Eleanor Fleming, who gave a powerful presentation on anti-racism and dentistry. And a lot of the feedback from the audience was like, Shavonne, you need to do this entire presentation again. More people need to see this. This needs to be on a bigger platform. So just, it's very rewarding to be able to open somebody's eyes up to and get them interested and excited about these kinds of topics. The other event that I'm really proud of is the International Symposium on preventive and non-surgical dentistry. It was very life changing for some dental hygienists to see these advanced modalities that they could be implementing into their practices to be more minimally or non-invasive in the kind of care that they provide. So being able to fill those, we have, there's lots of different technologies and equipment, but there's nowhere to go to really get hands-on. Being able to give dental hygienists a space and opportunity to come and get hands-on especially at the Phone School of Dental Hygiene, where it all began. The other thing that I do is I do a lot of continuing education events on dental ethics and law, and helping dental hygienists understand how to use these two things to leverage their role as dental hygienists, and really gain more autonomy in the work that they do. I do a program with a few other dental hygienists called Forging New Pathways, the dental hygienist's role in advancing the oral health knowledge base. So, trying to encourage dental hygienists to consider a role in research. I do a program with Susan Newkirk on social responsibility and its role in advocating in state dental practice acts, and we do a really good job of walking through the history of dental hygiene. Where we were, where we are now, and where we need to be. Then of course, I think I'm most widely known for my background in dental implants.
Yeah.
Before the pandemic, I was working as implant care practitioner in oral surgery, and I've done lots of work around both lecturing and hands-on program, and helping to build curriculum. And my endpoint goal is independent practice. It's professional autonomy, and because of that, I have my hands in a lot of different things, from education, from advocacy, from research. I serve on many different committees and coalitions. I work with a group of dental hygienists, the Dental Codology Consortium, where we actually create and submit codes to the ADA Code Maintenance Committee for consideration, because, again, we're trying to gain professional autonomy. We have to advance the profession. All of these spaces need to be tapped into. And I always like to say to dental hygienists that are interested in doing this kind of work, like, if there's not a seat at the table for you, then bring the folding chair.
Facts. Facts. Yes.
Bring your folding chair, like I
Yes.
do, to these tables and these rooms, because we deserve to be in this space, and we need to be in this space. It's our social responsibility, to be here. So
Yes. That's awesome. Thank you for sharing all that. That is awesome. No, the professional autonomy, that not to get too personal, but that's definitely been a reoccurring theme in my own
hmm
life in more ways than one, and thinking about others in this day and age we're at. Are there any upcoming meetings, events that you're hosting that you're looking forward to?
September of 2025, September 13th, 2025, will be the fourth annual Public Health Priorities Dental Symposium. Right now, I am working diligently to plan my courses for next year. So I have some things in the work, but I don't have anything to share right now. But if people are interested, they can definitely visit my website, www.ahigherlearning.co, and sign up for updates so that they could receive this information as soon as it becomes available.
Fantastic. And we will definitely do our part on our end to cross promote to our community. Because again, I think a lot of people who are part of our listening audience, especially those in the profession, could gain some valuable insights and learnings from what you're providing and offering to us.
Yeah, I think that especially, I am a dental hygienist, so that's who I know, and I think that dental hygienists are ready for change.
Mhm.
They just need somebody to look to lead them there. And I hope one day that I could position myself to be that leader. I'm definitely that leader on a local level here in Washington D.C. But I hope that I could lead the profession on a much bigger scale to what I like to say truly is freedom.
Yeah. You are doing the work. So seriously, Shavonne, I mean it when we say thank you. Because, again, that for the webs, just reading up on some of the stuff you're doing, I was like, oh, Siobhan's doing some things. Like, she's really doing some things. Let
I
me learn some
do,
more.
I do. I'm telling you, I do a lot of different things, and like I said, I'm not very good at I have a hard time of communicating those things because I'm in it. I'm doing
Hmm.
it. I don't look to do it for praise or anything like that. It's like I do it because it's necessary.
Yes.
And I love doing it. I love doing it, especially the political stuff. It's a great pleasure to be able to speak truth to power and represent the profession on that kind of level. So if you're out there and you're listening and you're interested and you want to get into this kind of like advocacy work, please connect with me. I would love to help you at least find a starting point.
Awesome. Before we sign off, I do like to ask our guests, are there any books or other forms of media that you're currently consuming that's sitting right now?
I'm glad that you asked that because, um, interestingly enough, the book that I'm reading right now is about the world's first dental hygienist.
Okay.
It was published by a dental hygienist, Linda Rhodes. It was published this year. So the world's first dental hygienist is a book that I'm reading right now. Um, I encourage, if you don't have like a LinkedIn account, I really do encourage people to consider that because LinkedIn has a lot of great resources. There are a lot of out of the box webinars and talks and even podcasts that I find on LinkedIn that are really relevant to the work that I do. So I don't have any of those things that I'm focusing on right now. It's just mostly this book that I'm reading.
That's awesome. I'll definitely have to check that out. Linda Rhodes.
Yes, yes,
Okay.
yes.
And on a similar note, since I heard you mention that you're a jazz head, um, Robert Glasper, Terrace Martin.
A little
The,
further back, Ella Fitzgerald, Louis Armstrong,
okay. Coltrane. Okay.
yes,
Okay.
Coltrane, Miles Davis. I had a whole spiritual awakening to John Coltrane's album, A Love Supreme. Yes,
I love that.
yes, 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 yes.
I love that. Have you read or heard of, I think it's called The Science of Jazz?
No, no.
I'll offline. I will send you a link to that. It's from Stefan Alexander, and so I really
Okay.
appreciate it's just like from that, definitely technical perspective to a degree, but there's something cosmic about it too. Just exploring the links between jazz music, science, like Coltrane and Einstein. Just
I'm very interested. I'm
mhm.
very interested. If you like documentaries and you haven't seen this one already, Chasing Train
No, I haven't
is
seen it.
is it Chasing Train? I can't. It's John Coltrane's documentary that's on Netflix. Very, very good. Very good.
I'll add it to the watch list.
Very good.
Well, Siobhan, again, thank you so much for sitting down with us, for sharing your story, your inspirations, the work that you're doing now with the higher learning in your community and beyond. And we look forward to staying in touch and hopefully being able to reconnect in the future.
Let's get